We're here today to support Dr. Roy and actually all of the orthopedic doctors here for the wonderful things that they do, my son being a prime example of doing extraordinary work.
Right now, Spencer's life, he walks with a walker. He's strong as an ox. He can, and he's the happiest kid probably in the room.
I want to support Dr. Roy and his research because I want other children to have the same quality of life that Spencer has now.
The Pediatric Orthopedic Research Fund was established by me to provide support through philanthropy for clinical research in pediatric orthopedic surgery. Small amounts of money in our hands goes a long way. We're able to get a lot of work, we get a lot of bang for the buck. But the basic fact is that we need philanthropic support as part of our research plan. Money to me has many purposes because it allows us to do the clinical research, to have the manpower to actually get the job done.
On so many levels, it's so great to see my patients and patients of my partners out there doing so well, having fun, moving around, playing, dancing, singing. It's great to see the kids in an environment that's not purely clinical, outside of the hospital room setting. It's by doing things like this that we're really able to pull off our core mission for improving care of the kids that we treat. There's 2 children out there that are dancing around with full body casts on who you would not know, whose curves are slowly going away over time because of this casting program. The support that we get from an event like this is great, and while it may not turn into a huge amount of money, it might support one research person for half of their year or something, which is unbelievable and allows us to do a huge amount of work.
Whenever we receive a large fund of money, we'll often put it towards a chair, and so the money is put into an account, and the interest off that account is then used to fund the position and used to fund research, so that instead of just having that money pay for one thing at one time, it's continually providing funds on end for an indeterminate amount of time.
It's been a goal of mine to establish funding for the division that is sustainable.
My name is Joshua Hyman, and I am a pediatric orthopedic surgeon. I run the Club Foot Center at Columbia, and I have a particular interest in lower extremity deformity and pediatric and adolescent hip disease. To me, it's fun and enjoyable to try and figure out better ways of treating them, and the only way we're able to do that is with research funding.
What happens to the multi-handicapped patient who turns 19, 20, 21? They've had all these wonderful, holistic pediatric providers with them all these years, and now all of a sudden they're thrown out in the cold. And so, especially if it's a fairly involved patient, the adult providers don't want to see them. They don't have any expertise in these childhood diseases.
I had a lot of complications before I met Dr. Roy, and a lot of surgery that didn't go well, and since I met him, my functionality has improved. I get around great, and I really owe the quality of my life to Dr. Roy.
Some donors wish to support a specific cause, so right now we're in the process of developing a cerebral palsy transition research center, and the purpose of this center is to help facilitate the transition of children into adulthood with cerebral palsy, because while there are many services available for them as children in children's hospitals, as they age out of those hospitals, it's very difficult to try to find them the services they need and to try to find physicians who are comfortable taking care of them with the special needs that they have.
Our center will connect the adult CP patient with the provider that they need to take care of the normal kinds of adult degenerative diseases that happen to all of us. In the end, what matters, particularly with musculoskeletal surgery, is have you improved function? Is that patient now better at playing ball, better at independent activities of daily living, more comfortable with their body?
As a mother of a son that has really benefited from this hospital and from all the expertise of many of the doctors here, we will do whatever we can to help support research for all sorts of disabilities that children have.
Your positive attitude and encouragement really inspired me to overcome my CP, and the surgeries that you performed made that physically possible. I want to thank you for being a unique and extraordinary surgeon, and for the immense positive impact that you had upon my life. Without your support and the help of my parents, I certainly wouldn't be here today. And I'm so grateful to you, and I feel so very lucky to have had you as my doctor. Thank you.